Yeah, the first important thing to know is there's multiple types of tests to see if you have the coronavirus. We're talking about two of them here. They both are done by a swab into your nose, and they both are intended to show whether you currently have the virus. The first one is called a PCR test. That one looks for the virus's genetic material. That's the kind that takes days or more than a week to come back. It's considered the gold standard for testing. But there's also what are called antigen tests or rapid tests that come back in minutes and look for proteins on the outside of the virus. They may be less accurate, mainly by missing some positives. Positive PCR tests, those tests that take longer, are always included in the state's total cases. But if you've ever gotten a rapid test and it was positive, your case is not in the total, unless you also went and got a PCR test. Instead, if you had symptoms, your case goes into a bucket of what are called probable cases. That also includes some other unconfirmed cases. The CDC says Oklahoma has 2,311 of those. Unclear how many are the rapid antigen tests. The obvious question that we asked OSU professor Jared Taylor, who's working with the state health department, why not include rapid tests in the state's total?
Because that test is not validated at the level and expected to be of the quality that the PCR test is, it is not considered a case.
That's guidance from the CDC, which says those rapid antigen tests should be considered probable if somebody has symptoms, not confirmed. The health department says that mixing confirmed and probable cases into one number could be confusing, but one major urgent care group, Express Wellness, says they're concerned that by not including those rapid results, more rural areas that rely on them could miss signs of an outbreak.
This information is important for these communities to have so that they can make decisions on mask ordinances or their strategies for returning to school.
Taylor says that while that's less than ideal, he's not gravely concerned about missing something.
If there truly is a notable node of infection, it's highly probable that we detect that from some number of individuals following up with testing and that sort of thing.
So at this point, you're probably left with the question, okay, how many positive rapid tests has the state not included yet in that confirmed cases number? The state was not able to give us that number by airtime today. We're continuing to work to bring that number to you. When we have it, we will let you know. In Oklahoma City, Dylan Richards, KOCO 5 News.